just like to thank Kidney Cancer Canada for having me here today. So my name is Dr. Linda Trin, and some of you may have recognized me from a few years ago. I was here at the Kidney Cancer Canada conference and explaining about the benefits of exercise for kidney cancer survivors. So I'm now an assistant professor at the University of Illinois at Urbana-Champaign, so that's 3 hours south of Chicago for some of you that do not know where Illinois or Urbana-Champaign is. So my research interests are in the area of exercise and cancer survivorship, particularly in kidney cancer survivors. So I'd first like to acknowledge Kidney Cancer Canada for providing funds, and Heather and her team for creating this exercise guidebook that you see on the table. So it's been really great that we're able to translate some of the evidence and the findings that we have from our research in kidney cancer into a patient resource that is practical and hopefully that you will enjoy reading. It was a collaborative effort, so it does consist of a team of researchers, myself and Dr. Guy Faulkner, who was my postdoc advisor when I was here at the University of Toronto. He's now at the University of British Columbia. I'd like to acknowledge Dr. Carrie Kernier, who was involved in the guidebook development as well, and Dr. Jennifer Jones, who is at the Princess Margaret Cancer Centre. I'd also like to acknowledge Kidney Cancer Research Network of Canada, who provided a fellowship to actually create the content in this guidebook as well. So in the spirit of exercising cancer, we know that when we attend these conferences, we're always seated in our chairs. So we're going to practice for the rest of the day. And whenever a speaker comes on and finishes, you're going to give them a standing ovation. So we're going to practice that. So every time a speaker is done, you're going to stand up and practice with a standing ovation. So let's do it right now. So everybody stand up and, all right. So I'm sure all of the speakers will appreciate that. And if you can't stand up, you can clap your hands above your head like this. That can also work. All right. So you're going to do that for the rest of the day. Any speaker that comes up, you can do a standing ovation. That just kind of breaks up your day so you're not sitting for the entire time. Okay, so is this the one to, okay. All right, so this guidebook, as you can see, is very lengthy. It's not meant to be a quick fix solution to exercising, so it is about changing your lifelong habits for exercise. So it is meant to not only tell you about how to do exercise, but it gives you strategies and how to overcome some of the barriers that kidney cancer survivors face. So it is developed using some of the research that we've done with kidney cancer survivors, and it's what kidney cancer survivors have said that were the most important benefits for them and the barriers that they face for exercise. So it is targeted for kidney cancer survivors who have completed treatment. So if you haven't completed treatment yet, that's okay. You can still, this information is still relevant for you. And I'll talk about what the exercise guidelines are for kidney cancer survivors. So it does provide you with tips to help you keep exercising when you find it hard to fit in, and it helps you reach your exercise goals by moving at a pace that is comfortable with you and that is realistic. So for the guidebook, it's meant to be read over several sessions, so it's not meant to be read in one, a 10-minute, sort of 10 to 15-minute read. So there is a lot of information. It can be overwhelming at times, but it's meant to be read over several sessions. It's intended for kidney cancer survivors, but it's also intended for caregivers as well, and for healthcare professionals and medical oncologists who might be interested in prescribing exercise to their patients. So I just want to talk a little bit about some of the contents that are in the guidebook. So if you want to turn to page 3, which is the first cover. It tells you about the different topics that we're going to be introducing. So it talks about how does exercise benefit you. So the exercise benefits that are listed there are what kidney cancer survivors have said. And one of the main benefits is that it can improve your quality of life. So research in kidney cancer survivors have showed that even if you exercise for small amounts of walking, even as little as 30 minutes a day, can actually improve your quality of life and reduce your fatigue levels, even for patients who are going through treatment. Another benefit for exercise is that it can actually improve your energy levels. It can help you prevent developing other types of cancer and for reducing other chronic diseases as well. And it also, if you look here, some of the side effects of kidney cancer treatments are things like increased blood pressure, or increased blood pressure is actually a common side effect for many drugs. So exercise can help with reducing blood pressure. It can also help manage weight, for example, which is cited as one of the benefits for exercise. And it can actually help you feel healthier and improve your health. And it's actually linked with better sleep quality as well. That's what other kidney cancer survivors and patients have cited. So the Canadian Exercise Guidelines suggest that the general population should engage in 150 minutes of moderate to vigorous physical activity. So you can see here that the American College of Sports Medicine, American College, or the American Cancer Society has created guidelines for cancer survivors, and that's to engage in 150 minutes of moderate to vigorous physical activity per week. It's also in your guidebook as well. And it suggests to include strength training at least 2 days a week. And it actually prompted the Cancer Care Ontario to create the Canadian Cancer Survivorship Guidelines for exercise, and that's in line and the same as the public health guidelines for the general population. And if you're going through treatment, the idea is to avoid inactivity. So you can do as much as you can tolerate, but the idea is to avoid inactivity during that time. So I just wanted to show you a quote by Deb Maskins, who is a longtime supporter of kidney cancer, and she gave us a quote here that talks about the benefits of exercise and whether or not she faces surgery again or drug treatment or a happy prospect of old age, being more active will help in every way. So this is a quote that's featured in the guidebook. And also the guidebook is meant to be very interactive. So it goes through various topics related to kidney cancer, such as barriers to physical activity and coping with lapses. And it's also interactive in that there are activities that you can do to plan for your physical activity. And there's also a weekly exercise log to keep track of how much you're doing. So it does talk about, there's a special topic as well on sitting time in cancer, so reducing your sitting time throughout the day. It gives you tips such as reducing sitting time while you're at home. So if you're watching television, stand up during commercial breaks, things like that. So that's also outlined in the guidebook as well. So the Canadian Cancer Survivorship Guidelines suggest to do 150 minutes of moderate to physical activity. It doesn't have to be all done at once. It can be done in 10-minute bouts. You can break it up, do 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening, and you have 30 minutes. And if you have any more, if you'd like to contact me for specific information on the guidebook, you can email me at ltrin@illinois.edu. Thank you.